All right. Live on YouTube right now, about a minute out from the webinar. John, I do have your slides, so we should be good. All right, Tim, about 30 seconds. And go ahead, Tim.
Well, good morning. I'm Tim Sheehy, president of the MMAC, and welcome to the Business of Metro Milwaukee. This monthly webinar has two goals: to provide you with insights that help you make better business decisions and to inform you of the challenges and opportunities to growing the region's prosperity. Today's program is sponsored by United Healthcare. MMAC has partnered with United Healthcare to make it easier to find a health plan that works for your employees and your bottom line. United Healthcare's level funded plan offers coverage for companies with as few as 5 employees, allowing smaller and mid-sized companies to take advantage of benefits typically reserved for larger companies, like underwriting for more competitive pricing, better data so you know where your premium dollars are going, a potential surplus if claims are lower than expected, and access to critical illness, accident protection, and hospital indemnity plans to provide further financial security for your employees. In short, it's a great benefit to help you recruit and retain talent in this challenging environment. The best plug I can give this program comes from the 565 companies who have signed up over the last 9 months to provide coverage for more than 19,000 employees and their dependents. An MMAC affiliated broker can help you receive discounted rates. So contact your MMAC broker or visit MMAC.org to learn more. We begin today's program with a discussion of the #1 issue facing employers in the region: finding and retaining talent. Joining us are Susan Kane, Vice President of Talent and Industry Partnerships for MMAC and M7, the Regional Economic Development Collaboration, and John Swallow, President of Carthage College and Chair of the Higher Education Regional Alliance, a collaboration of 18 of Southeastern Wisconsin's public, private, 2- and 4-year colleges. And then, as usual, we'll be joined at 11:30 by Dr. John Raymond for a healthcare update and a discussion on the business of healthcare. So Susan, as we bring you in here, and I'm just looking at some of the national data that shows we have some 11 million job openings with only 6.5 million people looking for work. And then closer to home here in the region, if you just look at the top 5 job openings, we've got the top 5 jobs posted, we've got some 56,000 job openings. So what are some of the ways we're working to help employers address the gap in available job openings and talent readiness of the region's labor pool?
Right. Well, data arms us very well for that challenge. So I'll start with some fairly good news, which is it may not feel like it yet, but the labor market nationally bounced back in a short 2-year time frame, much shorter than the previous recession, where it took 12 years for employment to reach the previous levels in 2008. Next slide, please. Unfortunately, though, in Milwaukee, our recovery is lagging the national average, and we haven't seen a return yet to pre-pandemic employment and workforce participation levels yet. We're still seeing high quit rates, which earned the last few months the name the Great Resignation. But overall quit rates tend to be balanced out by strong hiring rates. And we're starting to see evidence that workers who've been on the sidelines in higher proportions throughout the pandemic, like working mothers, early retirees, are starting to come back into the workforce. So that's great news. Next slide, please. So what are the top 10 posted jobs right now in the Milwaukee region? Number one is registered nurses with almost 7,500 unique postings in the last 6 months. You see for nurses, the posting intensity is 2 to 1, which means for every opening, it's posted twice or in 2 different places. Incidentally, this ratio was much higher during 2021, which could indicate that the nursing shortage might be on the road to improvement. You see here many openings for salespeople, retail, hospitality workers, and managers. And this reflects how consumer demand has really picked up even in the service sectors. But one drawback of here is the top 7 of the top 10 jobs posted are difficult, if not impossible, to perform remotely or to offer a work from home option. And we know flexibility is the new non-negotiable for many workers. In fact, 1 in 3 employees say they would forego a pay raise to have more control over their work location and their hours. So you see higher posting intensities for in-person roles because of that, like freight loaders and stockers, fast food workers, etc. Next slide, please. So as we think about longer term talent development though, it's helpful to take a longer view at jobs that are projected to be in highest demand several years out. This information is valuable for higher education, training, and workforce development partners to help determine what roles will be the most critical to drive our economy forward and create the most opportunities for career growth for individuals. This is the real sweet spot for economic development, high wage, with great opportunities for career advancement. So to make this most relevant for higher education and focus on jobs with great career paths, I filtered this list to reflect jobs that require at least some education beyond high school. So anything from a CDL license or a technical certificate to a bachelor's degree, master's, or PhD. If you look closely at this slide and the next, you'll see clusters of jobs in certain industries that should really be the focus of talent development initiatives if we want to keep up with industry growth. Healthcare jobs will continue to be plentiful, especially those in patient care, like nurses, physicians, physical therapists, pharmacists, etc. Next slide, please. This is the next set of 20 jobs in a row. I coded healthcare jobs in blue on this slide, business and finance in green, and technology jobs in yellow to reflect the clusters of jobs with the highest growth potential for future talent. The information here is taken from the same source as the real-time job postings data I shared earlier. MC Burning Glass is a well-known labor market data partner that helps MMAC provide members and partners with great actionable business intelligence. And in a little bit, I'll share how a new MC product called Skillscape can take us one step further by quantifying supply and demand in a more useful way using skills as the currency. So as you can imagine, it's really helpful for those in higher education and workforce development to see this type of job forecasting to make sure we have the right number and mix of programs in the region to meet future needs. The obvious one here is nursing, and I'm sure Dr. Swallow will be talking later how the region's nursing programs are collaborating to accelerate the pipeline of nursing students to help close that gap. Next slide, please. But at the same time, requirements for those roles are evolving very quickly, along with advances in automation, artificial intelligence, machine learning, and the digital transformation that's happening across all industries. And because of this, there's more information that higher education needs to make sure the knowledge and skills baked into curriculum match what future employees will need to be successful in those roles. So most colleges convene industry advisory boards for just that purpose, to review curriculum and ensure that what's taught in the classroom is aligned to industry needs. Some of that feedback, though, is anecdotal. It's specific to that particular company who serves on the industry advisory board, and it may not always reflect the industry as a whole. That's one limitation of that. So we've recently added MC Burning Glass Skillscape to our toolkit, and we're looking forward to taking the information to industry groups and to higher education and workforce development partners, and really any audience that's invested in the skills of our region's workforce, aligning with where demand is going. Next slide, please. So for example, the more traditional labor market forecast that I shared a few slides earlier told us the Milwaukee region will need approximately 8,500 industrial and mechanical engineers in 2025. And because those jobs are critical for economic growth in our region, given the size of our advanced manufacturing sector, and they have a median wage of $79,000, it makes sense for industry and economic development to collaborate with education to grow that pipeline. So our new tool shows the supply and demand of key skills within that career cluster of industrial and mechanical engineering, so that we can ensure that the region's existing programs incorporate these key skills in their curriculum. And we can even go further to see demographic breakdown and the supply and demand of specific skills within each sub area. For example, if I click on that second arrow, industrial engineering, quality engineering, we find there is an undersupply of talent overall, and there's low representation of females, Black, and Hispanic talent within the region's supply. Next slide, please. We see that the top skills requested by employers in this cluster of quality engineering are auditing, corrective and protective action, lean, continuous improvement, quality management systems, etc. All of which show higher demand as reflected by the dark bar compared to supply, which is the lighter blue bar. These top 5 skills are undersupplied right now in the Milwaukee region, which means there are skills gaps in quality engineering that could be addressed either in the future through additions to engineering curriculum, or addressed now through upskilling or on-the-job training of workers with some, but maybe not all of those top skills. Next slide, please. Skillscape can also help us break down the requirements of a job that maybe isn't tied as directly to a college program like engineering is, and can help higher education design upskilling or stackable certificate programs. For example, the role of project manager here is in high demand, but people don't typically major in project management in college. For this type of role, the right skills are developed through a combination of education, experience, and on-the-job learning. So we're seeing project management certificates pop up in continuing ed programs or as an add-on to say a business or a computer science degree. This slide shows the top skills requested in job postings for a project manager in the Milwaukee region. Things like agile methodology, project scoping, and scheduling. In education, this is the place where innovation is happening when it comes to building short-term and stackable certificate programs that have real value in the marketplace for both employers and learners. Going back for continuing education or a new degree is both expensive and it's a huge investment of time. So we can help guide learners to the credentials that really matter to employers and make sure that their investment pays off. And because the median wage for a project manager is $76,000, because there is serious undersupply and there's room to grow in terms of the proportion of female, Black, and Hispanic project managers, this one is also ripe for a regional upskilling initiative. Skillscape can help identify which adjacent skills do exist currently in pockets of our talent supply and which skills we would need to be train on at scale to be able to fill the thousands of project manager roles available in our region. So there's a lot more to share about our exciting new tools, but I wanted to give a sneak peek of how real-time skills data can complement labor market projections and give a more comprehensive picture than industry advisory boards alone can do. It won't replace the need to convene industry around the table, but we look forward to working with Dr. Swallow and his partners within the Higher Education Regional Alliance to make sure that programs in the region provide the right skills that really will pay off for everybody.
Thanks, Susan. Very informative at a high level in terms of how the region's developing a strategy to meet the needs of employers. And I want to bring John into the discussion. And John, maybe for starters, can you describe kind of HERA and its founding and its goals? I think it's a very innovative way in which 2- and 4-year institutions are engaging with not only students, but with the business community.
Yes, well, thank you, Tim, and Susan, thank you. That was great. It'll be great to talk about that data. So HERA was founded in 2018, really due to the great work of Chancellor Mark Money at UW-Milwaukee to bring together all 18 post-secondary institutions in the M7 area. So that's 2-year and 4-year public and private. It's very unusual across the country to see this sort of consortium. And then at the same time, we brought together, as you can see already, economic development, workforce development, community-based organizations. So 11 others that add to the 18 to form our steering committee. And our goal is, I think, really the goal that all of us share, but we're taking the higher education perspective on it, which is that we need more post-secondary graduates in the M7 area to fill the region's workforce needs. And so HERA is taking responsibility for the 140,000 existing students in our post-secondary institutions, and would like to grow that number, grow the number who first succeed, as in retain and graduate from our institutions. Second, grow the number that are coming out in the programs that are needed in the region. So we call that aligning programs. And then also making a smoother transition from graduation to securing a job, we hope, again, in the region. So those are our 3 pillars, if you call it that: the student success in graduation, program alignment, and then the talent bridge. So we came together in 2018. We still think of ourselves as a bit of a startup. So Mark Money was the chair for the first 3 years, and I've chaired since 21. And we are very interested in using data to try to align our programs with the needs of the workforce. And we're also very interested in this sort of conversation about how we can work together with employers so that the whole ecosystem works. There are a number of transition points into college, into a program, graduation, into the workforce, and we really need to make all of those as smooth as possible.
So John, one of the questions we get a lot from employers who are looking to bring talent into their organizations, especially with 2-year and 4-year institutions, is how do I find interns? And how would a company work with an organization like HERA to help fill their internship pipeline?
Oh, great question. So we have moved to a single platform for posting jobs and internship possibilities called Handshake. So this was some early work we did to realize that it doesn't make sense for thousands of employers to try to deal separately with 18 post-secondary institutions and to have different software packages and different technology. So it's possible to post your job and internship in one place and then select the institutions you'd like to receive students from, perhaps which have the programs that are aligned that way. And I'm definitely here to say that all of the career centers on our campuses are very interested in increasing the number of internships from the student side, but also I would say from the throughput side. Businesses will have a much higher likelihood of hiring one of our students if they get in early with that relationship. And so, you take somebody who's in a high demand field, let's say a nurse, or let's say an engineer, they're going to have a lot of opportunities. But if they already know some folks in Milwaukee or in the M7 region, then they're much more likely to want to stay. And so that's an opportunity really for all of us. The internships help educate, but they also help employ.
And then on the flip side of that, how do you help students identify where there are internships in the region so we can keep some of that talent here?
So we are always looking for more help. So I would say every institution is seeking to have lists of internships through that technology platform to match them with student interest. But sometimes it appears for some fields that we don't have enough. I know that some businesses don't have a full-fledged internship program. We would be willing to help in all aspects of that. There's an internship gap, and it will be better for students and better for employers to fill those. Now, we did start by aggregating our own data. So even 4 years ago, it was not possible to know the number of degrees in our M7 region granted annually in different fields, or even disaggregating that by race and ethnicity and gender and so on. We can now do that. So we can see where some of the gaps are at the degree level. But the great thing about Susan's work now is that we can identify this at a deeper level with skills, and we can try to align our programs with that. But even that, we will gain more together if we have that partnership with business to access the students earlier through the internships and maybe even help them gain those skills so that they're employable locally.
Great. John, let me ask you the question and Susan the question from the perspective of the universities and your experience, and Susan, yours working with companies. What's the biggest thing that's missing here in the region? Where do we need to focus best to connect this emerging talent with the needs that companies have?
You want to go first, Susan?
You know, there's sometimes that fuzzy gap between the getting of a credential, a bachelor's degree, and then, the employer perception that that individual is work ready and ready to add value immediately in a skilled position. So it's like that transition point. I think, we could probably do a lot more to offer some of those certificates or those really, market valuable credentials, even while we're still in a 4-year program, to ensure the employer that the student has, those cutting edge, really marketable skills in that moment.
Yeah, I'd agree with that, that the system still seems complicated in that we have different degrees, sometimes different skills within the degrees. And then, if you take internships out, I mean, basically the matching process into jobs is just a very complicated process with job boards, and it kind of feels like it's out of the 1950s, frankly. I mean, so we were applying 21st century technology to a 1950s idea. And I think I can speak on behalf of the institutions here to say, we would love to explore some tighter partnerships and even deals with employers to produce the graduates they might need. So for instance, we know that hospital systems can pay sometimes upwards of $25,000 to recruit a single nurse. So that's money, those are resources that are being allocated in the recruitment process. I'm here to say that, at least on Carthage's behalf, but I know this is true for others, if we had a deal where some resources would come our way in exchange for having employees that were hireable, and I know there are no guarantees here, but we could monitor the flow. We would be delighted to try to put those resources to use to attract students into those particular programs. And so it gets a little bit beyond the showing up in class and meeting the students and that kind of relationship, and it invests the institution a little more forcefully in the success of the business environment. So again, just like Susan said, the industry advisory boards can be helpful, but that's different from a situation where a business is basically, buying our product. And believe me, if we knew that our product would be sold to a particular business, we would be working to make sure that that happened. And so that's where that tighter connection can happen.
And that's really, we encourage our employers to take that approach. It's like a supply chain approach, talent supply chain approach, where the employer realizes they're the end user, the end customer of your talent pipeline. And if I don't, if I can't use what's coming off, the pipeline, I need to get involved earlier in the process to ensure that my requirements and my specs are in that, baked into that process. So it's something that they're very familiar with when it comes to production and supply chain, and it's time to apply that same mentality, methodology to talent.
Yeah, just remind if you've got questions, please drop them in the Q&A, and we'll be happy to get them to our panelists. John, a lot of discussion about demographics as students are flowing into 2-year and 4-year institutions. What are you seeing in the region, and do we need to do more to get students to and through the institutions that make up HERA?
Well, the answer is definitely yes. So if we look at demographics, if we go back to what we call the Great Recession, 2008, 2009, the birth rate dropped. And that means that if you add 18 years, there are people who would have been coming out of high school who now aren't. And so where we will see this is in 2026, there'll be in the Midwest a drop of high school graduates. So even before they get into our system of, let's say, roughly 10%, which is a very significant number. If you just track what's happening in enrollment in the various Wisconsin school systems, you can see it already coming. And so the colleges are very concerned about this because, of course, these are, frankly, the people we serve. And so that we're going to have fewer of them. So we need more of them. And then we need more of them to be successful. So we are very focused on trying to make sure that the students that do choose one of our institutions remain and graduate. And so that's certainly on us to increase those retention and graduation rates. And then if we can have a greater pull from the employers to make sure that students know that those jobs are out there, they're going to be employed, that it's going to work out, then we have a fighting chance to deal with what is coming. And so we know there are a lot of retirees retiring out of the workforce even before, lots of people were quitting. And so we definitely need to be replacing these folks in the workforce in the region. And so we do have a real challenge together, which is the demographics around it.
I see a lot of innovation and collaboration happening at the HERA level with institutions reevaluating their programming for adult learners, or looking at someone's not going to job out and become a full-time student after already being in the workforce, having responsibilities to family and bills and mortgages. So how can the higher education landscape continue to innovate to deliver shorter term, really market relevant training and continuing education to get more people off the sidelines or to get them upskilled, and then we can backfill those entry level roles with some more folks off the sidelines.
Yes, absolutely. So this is certainly on the radar, and in fact, in the business interest of the 18 institutions to have badges or micro credentials, or call them what you like, certifications. And a number of institutions in the area have started to offer these. And HERA is now putting together, we will be able to announce soon, one portal where businesses in the region can see all of those that are being offered at the various institutions. This is an entrepreneurial moment for institutions, and some are offering the badges and hoping for great uptake. But we all know that just offering something doesn't mean that people will be there on the other end to buy it, because the timing might be off or the particular offering might be off. And so this really is a wonderful moment. If a business has ideas for the sort of upskilling their employees need, I'm here to say that institutions would like to talk to you and then to customize a program. And so the more we can do that, the more successful we'll all be.
Yeah, there's a question in the chat that is impactful to both employers and to 2-year and 4-year institutions. And it goes to addressing the challenge of not getting enough kids prepared for 2-year and 4-year institutions and through high school. And, kind of what can universities and what can employers do to, Susan, to use your words, to reach even deeper into the pipeline. And so John, I'd toss that out to both you and Susan.
Well, I will say that we have seen, because of the pandemic, a drop in learning from students in high school. And so all the colleges are faced with this now. And then we're trying to meet the students where they are and still ensure that they can retain and graduate on time, which means that some of our courses are going to need to change focus. But at least we have, in the 2-year case, 2 years, or 4-year case, 4 years to work on that problem. But looking back even earlier in the pipeline can help too. I would say not to be lost here is the more employers can help market the future job opportunities. Mm-hmm. It's just not the case that a lot of 15 or 16-year-olds or their parents really understand the current outlook for jobs and even what the jobs will be. And I use the example of somebody who's like a virtual reality specialist at a hospital who might be able to help patients understand what's going on in their body. I can tell you when I talk to parents, nobody is saying, I want, Susie to be a virtual reality specialist at the hospital. They've never even heard of it. And so that's another place where we can really partner to help parents see the wide range of opportunity and then encourage their kids to point in those directions.
And I'm really happy to share that we are using that MC burning glass data today. We consult with public school districts in the region as they're planning their career and technical ed programs and their career pathway programs. And we are sharing with them the high growth industry clusters, even the skills within those industry clusters that will be in high demand, to make sure that that's baked in as early as K-12. And many of our school districts are working to embed dual enrollment opportunities in K-12 so that students graduate from high school already with some college credits. And that goes a long way toward that likelihood that they'll enroll and actually, persist and complete in a post-secondary credential.
Yeah, really good point, Susan. And, something we shouldn't overlook, just earlier this week, we had 300 MPS students out to see all the jobs that are arraigned around the baseball field. They met with the Brewers, but they were really looking at the jobs that were off the field. And as one of the students put it, I can't be what I can't see. So to your point, John, I think there's a lot of impetus for employers and others to show these young students the kinds of careers that are out there that they can take a path on with a 2 or 4 year degree and expose them to that and create that spark, as we call it. And we've done that with over 15,000 MPS students. So lots more to be done there. Before I turn it to Dr. Raymond, John, let me come back with you a question that's in here about how the 2 and 4 year institutions are looking at bridging the financial gap for those who can't afford an education or continuing education, which we know is a big challenge in the region.
Now, that's a good one. And I don't think we want our economy to be based on philanthropic dollars, as wonderful as those are. And this is, believe me, all the institutions will be stronger for them. But when it comes to a system level approach, the upskilling that employees need has to be funded somehow. Colleges are generally not known for producing large surpluses. So if it's not from philanthropy, it simply doesn't work for us. However, I think we all agree that there's greater value in that employee over time if they're gaining the right skills. And so transferring some of that value into a deal at the front end so that it could be paid off over time, something like that. There's got to be an economic arrangement that can make this work, but we just have to be creative about it.
Yeah, thank you. Well, we're going to turn here to Dr. Raymond, but Susan, thank you very much for the insightful look at the region and what we're doing. And John, really appreciative of not only your leadership at Carthage, but your sharing of the Higher Education Regional Alliance. I think it's a great asset to the students and to the business community. So we look forward to hearing more from you on that. So John and Susan, thank you very much. And I'm going to bring Dr. Raymond in here to give us a little bit of an update on where we stand from a healthcare perspective, and then also delve here a little bit into the business of healthcare.
Yeah, thank you so much, Tim, and good morning, everybody. As Tim said, I'm going to give a very brief update on where we are with COVID-19, and then talk a little bit about the business of healthcare in the United States. As always, these slides are facilitated by data collection and analytics from MCW's Institute for Health and Equity. Our analyst there is Ali Namadi. If we can go to the next slide, please. Okay, I want to give you a caveat here. The numbers are up, but they're probably up more than the actual case counts because there's been a delay in reporting cases through DHS. So I want to make sure that people don't overreact to the unfavorable trends that we're seeing here. So our 7-day average is 621. We had a very significant number of cases reported last Thursday and Friday and over the weekend that seemed to be a significant jump over what we were seeing before. Those seem to be coming down now, but in aggregate, they still appear to be trending up, inching upward a little bit. Our positivity rate's going up, so that is an indicator that the case counts are also probably going up. And the R is over 1. Again, that 1.5 number is probably exaggerated based on the delayed reporting that gave us a bolus of cases that actually happened a week or two ago that were reported over the last 5 to 6 days. Looking down to Milwaukee, similar trends. Our average, excluding 2 days of very high reporting, would be just a little bit under 100. That's still a significant increase, but again, inching up and not surging upward. Same with the 4.1% positivity rate. And again, the R is probably over 1, but I think the 1.8 is exaggerated by the delayed reporting. I also just want to talk about a couple of other trends here. The wastewater levels of COVID-19 expressed as 1 million copies per person per day have been trending up. They did not bump up when these cases bumped up to the same level, but we went from about 2 million per day here in southeastern Wisconsin up to about 8 million over the last month or so. So again, there is a slight upward trend that we need to pay attention to. Hospitalizations are stable to trending favorably. We're at the low point that we've been since last May. We're down to less than 25 people in intensive care units in Wisconsin with COVID, and about 150 people with COVID-19 in all of Wisconsin that are hospitalized right now. Deaths are stable. They were trending downward. They're at about 10 per day. And again, it's a trend that we need to monitor as we see cases start to inch upward. But all in all, we're in a holding pattern. One thing I want to point out is even though we trended very favorably for a long time, it bears notice that we have, as a state, have never been better than high levels of COVID-19 community transmission. So even though your individual risk might be low, especially if you're vaccinated and are wearing masks when you're in crowds, we still have a high rate of community transmission. So that would be over 100 cases per 100,000 people over the last 2 weeks. Now, if you look at the county map for last week, and these numbers will be updated tomorrow, about half the counties had medium transmission and the other half had high. But what we did see was most of the counties were stable, but there was a handful going upward. So again, just worth monitoring what's going to happen over the next week or two. The next slide, please. So I'd like to pivot to the business of healthcare in the United States. And if we can go to the next slide, just make some high-level observations. The US healthcare system is the most expensive in the world, and our health outcomes, although they're good, lag other developed countries. And that's a fact that we can't explain away. People tend to say that we have a less healthy population, that we have a more diverse population than many of our peer developed countries, and that is true, but it probably can't account for all of the difference in our outcomes. And we spent 19% of our GDP on healthcare in 2020. Part of that was increased spending from COVID and that our GDP went down by 2%. So as a proportion, we went up from the mid 17% up to 19, but still, that's a lot. And the closest country to us was Switzerland at 12%. As I mentioned, that should say 2020. The US GDP declined by 2% in 2020, and healthcare spending went up due to COVID-19. Yet we're still hovering at about 19% of the GDP. One thing that is different about the US compared to other peer countries is that we actually spend significantly less per capita on public health and prevention measures than other countries. We, as a ratio, we invest a lot more in health care than we do in public health. Next slide, please. Just here's a plot of developed countries showing that as the GDP increases, going from the left to the right, the per capita spending on healthcare increases. And it's almost a linear plot with one outlier. That green dot there is the United States, where we have very significantly higher spending per capita on healthcare And we're off this very clear line compared to our peers. Next slide, please. And you can see here again, per capita dollar expenditures, United States in green there, at almost 12,000 per person per year, 80% higher than Switzerland, which is our highest spending peer, and double the average of developed countries. So this really, I think, should give us pause and should cause our country to re-examine our priorities and as to where we're investing our healthcare dollars. Next slide, please. Our healthcare system is complicated. You see that we've got the providers, predominantly physician-driven here in the US, the hospitals and health systems, the payers and the insurers. And what may be different about us compared to other developed countries is that we've got this big employer box. Employer-funded health insurance is relatively unique to the United States, at least in terms of its scale and scope. And in the middle of all this, we have patients who are becoming more and more consumer-oriented. So that's not that different than most places, other than the fact that we probably have more private payers and more employer-based payment schemes for healthcare than many peer countries. Next slide. Now, this is where it gets very complicated and fragmented. All of these individuals either bill or pay or receive services, these boxes, and I only put a small slice of the different entities that are here. And one of the problems is we have poor vertical and horizontal integration of all these components of the payment system for healthcare in the United States. And you can see that this is very complicated in terms of the providers, very complicated in terms of health systems, laboratories, pharmacies, rehabilitation, nursing homes, diagnostics. The payers actually are quite fragmented. You have three major government payers: Medicare, Medicaid, and TRICARE. You have private payers, you have exchanges, brokers, narrow network products, third-party administrators that take care of the slice of the business. And then employers are starting to come together, either as employer alliances or by partnering with third-party aggregators, where they use their strength and their leverage to try to get favorable deals with the providers and with insurance companies. Next slide, please. So as I said, the US healthcare is the most expensive in the world, but our outcomes lag other countries. I hope that you can see that our system is fragmented, it's complicated, it has bloat for sure. And there's a poor connection between public health and healthcare infrastructure in the US. And that was very, very quickly highlighted during COVID-19. The silver lining is that the COVID-19 pandemic did force new and better connections to be made amongst healthcare providers and the public health infrastructure of the country, but we actually have a long way to go. And as I mentioned, the US spends less per capita on public health and prevention than peer countries do. And I'll show you that on the next slide. I'm sorry, maybe one more slide after that, but yeah, you can see here, this is the ratio of health and social care spending in developed countries. And just a few there, you can see that France, Germany, and the United Kingdom spend a lot more on prevention and social care than the US or Canada. Canada's the nearest peer to us, where they have relatively equal investments in social care and healthcare, but we're the only country that spends less on social care than healthcare. So we're kind of letting people get sick and taking care of things on the back end instead of the front end. Chris, can we go back one slide? I did want to just talk about a couple of issues with the US healthcare system. As I mentioned, there are legal barriers to having vertical and horizontal integration. We have strict regulation that is meant to really to prevent antitrust issues, but these actually get in the way sometimes. And fee for service is still the coin of the realm, so to speak, in many markets. And so you get rewarded for doing more tests, having more patients, and doing more things to them. And there are many, many different fee schedules that complicate issues and add to the administrative burden. There are inadequate rewards in the payment system for the patient experience, efficiency, and quality. Again, it's a per-click mentality. And there's an enormous burden of documentation for our providers. I want to make sure everyone knows doctors, nurses, pharmacists, physical therapists, the whole array of people working on the front lines are incredibly burdened by having to put their hands on a keyboard and their eyes on a computer screen rather than having their hands laid on a patient or their eyes making contact with the people that they're supposed to serve. This is a dissatisfier. It adds enormously to the burden of work for the providers, and it adds to the cost of our healthcare here. And I don't think that it materially diminishes fraud, but people may disagree with me, but the cost of these documentation burdens is enormous. And the increase, one of the things that's peculiar about the economy of healthcare in the US is that as you get bigger, you would expect that scale would help you lower cost. That hasn't happened yet in the US. Mega regional systems, large national healthcare providers have not meaningfully reduced the unit cost of their healthcare. Next slide, please. Right, next slide. So health is about more than healthcare. I want to talk about the social determinants of health and what other countries invest in that we don't. You can see here, healthcare is an important component of overall health, but it's a small component. Behavior, genes, and social determinants are very, very important, and we need to focus more on those. Next slide, please. Next slide. So what are social determinants of health? Healthcare access and quality. Not everybody is able to have easy transportation or job flexibility to go get healthcare. Education is important. Having high quality education contributes to your overall quality of health, independent of your access to healthcare. The social and community context matters. Economic stability matters. So people living in homes where they can transmit generational wealth to their kids is important. And many people in our society don't benefit from that. And having safe and stable neighborhoods and homes that are conducive to learning, having access to food, all these things are critically important to the quality of health. And because we don't invest in those, we end up paying on the back end in poor quality of healthcare and higher cost of healthcare. Next slide, please. And with that, I want to say thank you and turn it back over to Tim.
Dr. Raymond, thank you. A couple questions, and one that kind of popped in my mind too. In your analysis of the cost per citizen between the US and Switzerland, is the assessment that we use more healthcare or that healthcare here is more expensive to deliver for the same services?
Yeah, it's a little bit of both, Tim. And the third equation is we probably have people in general who are sicker here. We have a higher burden of obesity and chronic disease that contributes to those healthcare costs.
Good. And you did talk a little bit about social care. What would that be, and how could it be expanded in your opinion?
Yeah, well, that's really the tough issue here. Getting people affordable homes and living wage jobs is really, really important. And that those are not traditional roles for health systems or insurance companies, although some are actually investing in those activities. Having kids that grow up in a family that is economically secure and doesn't live in rental properties and get evicted constantly, like we see, unfortunately, with a lot of the kids in Central City, Milwaukee. They don't have stable homes. Those are some areas of opportunity for us, but I would say having a better public health infrastructure, focusing on prevention, rewarding providers and health systems for keeping people out of the hospital, dealing with obesity and diabetes and hypertension. So our payment model also needs to change to incentivize those behaviors.
You know, as you look ahead and kind of tying back into the front part of the presentation here today on the talent shortages, as Susan was going through that list, I'm sure you saw and heard the number of openings in the healthcare field. So as you look ahead, what kind of an impact do you see the hiring and staffing crisis having on both the quality and cost of healthcare as we look forward in the region?
Well, the cost is going to go up. That, like other industries, the wages have gone up tremendously just over the last 2 years, in part because of COVID. Yet our income is fixed. We have contracts with private payers and the government that don't go up just because your costs go up. So that's going to put enormous strain on the financial viability of our health system, especially critical access hospitals out in rural and underserved urban areas that already are financially distressed. They're going to suffer.
Yeah, and this is a great topic and one we should probably circle back on, because I know we start this webinar with a discussion of this United Healthcare program that we have. Large employers aside, and I know they have challenges, this is still a very present issue for small and mid-sized employers, often case beyond, in addition to what you're paying in salary and compensation, the healthcare costs are usually second in that line. So again, as you look forward, any thoughts for employers in terms of what they can do?
It's such
and I know, John, you're a large employer yourself, so you've got this challenge also.
Yeah, well, just in terms of our employee benefits, we're trying to incentivize better health behaviors. And that is in some ways a satisfier for people, just that they know that their employer cares and is offering a unique suite of benefits. But I think this is an issue our country needs to grapple with in a much more intentional way than we have. We can't deploy 20% of our GDP for healthcare costs. It's not sustainable. Yeah. I do see one question there about normal hospital capacity. Most hospitals in the state run at about 80% capacity. That's the sweet spot for efficiency and not overstressing your staff. We've been running over 90% for 2 years, especially the ICUs. And so we're down back to what would be a normal capacity range for the burden of all diseases, not just COVID. And because as COVID has gone down, that's relieved some of the strain on the system.
Yeah, and then, again, there's a question in here about, and I've seen a lot of the presentations too, going back to the 1980s and 1990s. What do you think is the biggest barrier today to making progress on healthcare costs and quality of care?
A lack of investment in prevention. And you can argue about the social things, but we really don't prevent disease very well here. I think that the fee-for-service mindset here is a problem. I honestly don't believe that there's a lot of cost in defensive medicine, that even though people talk about it a lot, I just really think there's inefficiency in the system that we need to get rid of. I'm not in favor of a single payer system, but I would actually like some harmonization of fee structures for private pay, so that with maybe a market adjustment, so that we don't have hundreds, literally maybe thousands of different arrangements with payers for the same test or the same procedure. It just adds so much to the complexity and cost of care.
Yeah, and I think the other question in the chat you've kind of addressed is there's a shortage of healthcare workers, and you're pulling employees back and forth between institutions. That just adds to the tension. Until we get more people into the field to fill the need, we're going to continue to see that, presumably.
You're right. And we actually in healthcare have seen both a reshuffling and a great resignation. The politicization of healthcare measures, especially ivermectin and hydroxychloroquine, the violence and the extreme rhetoric that's gone on out in society has translated into the inpatient arena, into the emergency rooms. People are they're burnt out from overwork and from starting out the pandemic being called heroes when they didn't really want to be, to being called villains at the end of the pandemic. So there is a great resignation in healthcare. I'm not sure we're going to get those folks back. So as John was saying, HERA is going to have to work on filling the pipeline back up with new talent.
Maybe Dr. Raymond will finish with the last question here, and then let folks get to lunch. As I look at Philadelphia reinstituting a mask mandate, And then we jump across the world to see what's going on in Shanghai as they're trying to close a city with 25 million people. As you look ahead in the US and elsewhere, what do you see the coming months looking like in terms of COVID and our reaction to it?
We're probably going to have an increase. I mean, we're seeing it already. Whether it'll be a significant bump up like they saw in France and Italy and the UK remains to be seen, but BA2 was driving that, and that variant is here now. I'm hoping, and I think most people believe, absent the emergence of a new game-changing variant in the next few months, that as people move outdoors with the warm weather, we'll probably have lower levels of community transmission. They may still be in the medium to high range, but we won't be overwhelming our health systems. There won't be a lot of people dying from COVID. That what we really need to keep an eye on, though, is what happens in the fall when respiratory viruses tend to circulate. And people are tired of mitigation measures. 2 years is a long time to mitigate, and I think that's why China's having a problem. Their zero tolerance policy, even there, it can't work forever. And they didn't do a good job vaccinating people with high quality vaccines. And they didn't have a lot of infections, so they don't have a lot of post-infectious or natural immunity. So their problem is different than ours. We've had a lot of people infected. We've vaccinated a lot of people with high quality vaccines. So I would say that the issue in China for us is more economic than it is pandemic related in terms of infection.
All right, I'm going to squeeze one more in for you. Who should get a second booster and when?
That's a personal choice. Let me just say, if you have been fully vaccinated, you still have very good protection against being hospitalized or dying. Extraordinarily good, 10 to 20-fold better than if you're not vaccinated. But that protection is waning over time, and it's going to continue to wane. So one booster improves, it gives you more time and it gives you more protection. The second booster also, if you're 4 months out from your first booster, will increase your protection. But again, you're starting with a baseline of pretty good protection. So Tim, what I would say is a lot of people are waiting to see what they're going to say to do in the fall. Not everybody wants to get a 5th shot in the fall. But my wife and I decided to get a second booster, and we did that last week.
Okay. Dr. Raymond, again, you're very gracious with your time. I'll see you this afternoon at 4:05 on WTMJ, and we'll have a little chance again to talk about healthcare and the economy. John Swallow, Susan Kane, thank you very much. Enjoy the rest of your day, and thank you for joining us.